Hello and welcome. You have found the City of New Westminster's educational video resource for businesses on opioid use in New West. My name is Jennifer Miller and I work in public engagement at the City of New Westminster. Before we get started with our presenters, I would just like to offer a land acknowledgement for our recorded session. We recognize and respect that New Westminster is on the unceded and unsurrendered land of the Halkomelem speaking peoples. We acknowledge that colonial practices have made invisible their histories and connections to the land. As a city, we are learning and building relationships with the people whose lands we are on, and we invite you to join us in that journey. With that, I'm going to turn it over to my colleague, Jen Arbo, who's going to share a little bit more about the background of this session.
Thanks so much, Jennifer. So my name is Jen Arbo and I work in our Economic Development Division here at the City of New Westminster. And you might be wondering how economic development is introducing and setting up the background of a piece related to opioid and addiction. And so I want to give you a little bit of background information. Last October, Council instructed staff to put together a downtown livability strategy. And it was response to a lot of things that are happening in our downtown core right now. We are seeing an increase in homelessness. We are seeing an increase of, cleanliness issues. And so staff got together and put together a framework of what we would do. And so there's sort of 5 main areas of concern. One is cleanliness. And, that might be simply, picking up garbage more frequently. Another is around homelessness and increasing our shelter capacity. Another piece is around the opioid crisis and mental health. And then the last piece is around business support and engagement. And that's where economic development fits into this. This opioid education event tonight is really about how we can help businesses to address something that might be impacting them. We know from statistics that a lot of overdoses occur before work or after work and often on weekdays. And the construction and trades industry are frequently overrepresented in overdose statistics. And so we started thinking of ways that we can provide some educational materials to help. And through our partnership with the Downtown Business Improvement Association, who provided input, we decided to put together this event. And so while some of the information might focus really heavily on the construction and trades sector, it is really relevant to all businesses in New Westminster and all small businesses. We hope that the presenters will give you some information related to what you can do if you have an employee who you believe is using substances. It also provides you with some education around what to do in an emergency if there's actually an overdose. And we do encourage you to use the chapters feature on this video to click around to find the part of the video that's the most relevant to you. So with that, I would love to turn it over to our 4 great presenters tonight. And we hope that this video serves a purpose in our community to help us feel better educated and prepared.
I'd like to give a very warm welcome to our first presenters, Sydney Andrews and Travis Walker, who are here from the Lower Mainland Purpose Society. Purpose Society is a nonprofit organization providing a continuum of services to people in our community. Sydney is the Community Action Team Project Coordinator for New Westminster. She works to bring diverse community partners together at one table to identify and bridge gaps in services and interventions designed to prevent overdose deaths and enhance quality of care for New Westminster residents. Travis has been working in harm reduction for 6 years. He has been the coordinator of the Health Contact Center at Purpose Society here in New West since it opened in April 2021. Over to you, Sydney and Travis.
Thank you very much for that introduction. First thing we have today to share with you all is just this video that the Community Action Team made. The intention of this video is really just to humanize the experiences of people that use substances and their loved ones, as well as bring these experiences closer to home. The words that you'll hear in this video were actually from a survey of things that were said to people within our community. So I will play this now.
Once an addict, always an addict.
Why don't you just quit?
You deserve whatever happens to you.
You have no friends anymore. You're always asking for money.
Why would you do that to yourself?
Your addiction is your fault.
Get over it and move on. Just stop using.
Don't come home if you use.
I'm embarrassed to be seen with you.
People who use drugs are us, our friends, our family, and our neighbors. An unregulated supply keeps people who use drugs unsafe. The community is rallying to find solutions until effective policies are made. Be a resource. We're in this together.
I've got a purpose now.
Thank you. And I will pass it on to Travis for the next slide here.
Hi, so yeah, I'll just talk real quickly about the Health Contact Center and what we do here. So at the Health Contact Center, we offer a variety of services related to harm reduction, including a safe injection site where people who inject substances can use their drugs with trained, experienced staff present who can intervene in the event of an overdose. We've had about 80 overdoses on site since we opened in April 2021, and none of those overdose events have resulted in death. We also offer harm reduction supplies for both injecting and smoking drugs, take-home naloxone kits, overdose response training, and information and referrals to community resources, so people can come here. People who use substances can come here. We'll just do, on their first visit, we'll do a very brief intake with people. People don't have to share any personal information, and it's entirely confidential. No information is shared with anyone about people's use of the Health Contact Center. So yeah, next we'll talk about the one of the other services that we have recently started offering at the Health Contact Center is FTIR drug checking. So this is a drug checking service that we currently offer every day except for Saturdays, and we're hoping to expand it to every day very soon. People who want to get their drugs tested can drop off a very small amount. Just something the size of half of a match head, and we can get a result back to them within about 15 to 20 minutes. And this is, they'll get a fairly detailed result about what is in the drugs, and also in what general amount. So this is a great service for anybody who uses drugs, including people who are just casual or occasional users. Who want to be sure about that what's in their supply is safe. Again, they can drop this off with staff. Staff will ask a few very brief questions. Again, no personal information is required, and it's entirely confidential. Another service offered at Purpose is the mobile harm reduction van. So this is a mobile harm reduction service people can call. Call this number, the number displayed on the screen there, 604-351-1885, and we will, the health van will deliver, can deliver all sorts of harm reduction supplies to them, including safe injection equipment and smoking equipment, condoms and lube, safe sex supplies. They also have the take-home naloxone kits and can do the overdose response training, and they'll pick up any used harm reduction supplies, any used sharps, and dispose of them safely. They can also give information and referrals to community resources, and little small snacks and drinks and anything that people might need in that area, and information about bad dates and dangerous Johns as well. So that's a really great resource that services both New Westminster and the wider community from Burnaby all the way out to Maple Ridge.
Next, I'll let you guys know about our New Westminster pop-up clinic. So this is actually a little bit of a newer clinic. It does operate every Wednesday at Purpose. It's from 12 to 4. You should definitely call ahead and make an appointment. It's very, very busy. We see about 30 people in the 4 hours, which is quite a bit. It's run in partnership with VIDC. Dr. Conway is the doctor that's in charge of all the patients, as well as a few other nurses that come too. We do all sorts of point of care testing, HIV, hepatitis C, opioid agonist therapy, and other treatment options such as like methadone or safe supply, primary health care. So a lot of people come in with just like basic wounds and they'll be treated here as well as they're able to fill out persons with disability forms for folks that may need them. And if anyone doesn't have access to a phone and does want to come in and book an appointment, you can use our digital inclusion space upstairs to come down, and myself, Colin, or Lola will come down and help you book an appointment. The Digital Inclusion Project really aims to help people that are experiencing the digital divide. The digital divide is basically just the lack of opportunity experienced by people that have access to this new age of internet and those who do not. So we provide access to refurbished devices. We've given away about 160 devices to folks in our community so far in the first year and a bit of this project being established. And we also offer one-on-one support. So if people need to search something up on Google or learn how to use Word or learn how to make a resume, we'll help with anything as best we can. We are open Monday to Friday, 9 to 4, and drop-ins 1 to 3 on Thursday. A lot of the time people can just drop in anytime though, so doesn't really, that's just a baseline. If you have any questions about the Digital Inclusion Project or want to donate a device, contact Lola at 604-369-5514, and she's here Mondays, Tuesdays, and Fridays. I'm available and here Monday to Friday as well, so you can ask for myself or Lola and we'll be happy to answer any questions about this. Next, we have our last video, which was the other community action team, which Jennifer explained really well. It's just a diverse group of people that are interested in helping combat the ongoing opioid crisis within New Westminster and the surrounding communities. So this is kind of anti-stigma work that we did in partnership with Techno Monkey Media, and they did a really great job, as well as some of our peers and clients that we work with at Purpose are in the videos too. So it was a really great project to work on. And if anybody is interested in joining the CAT, we have community members, service providers, people with lived or living experience, you can contact me at 604-562-5102. But with that being said, I'll play this video as well.
We're at a time in our opioid crisis right now where most of the drugs that we see out there are poisoned and tainted with benzodiazepine.
Even though we have a safe injection site, there's many people outside that are still using drugs that are ODing around the neighborhood.
And because the drugs are so poisoned, the folks that are dying out there aren't getting the services that they need. They need to come here to have safe witness consumption, to engage with the staff so that they live to see tomorrow.
So we have our entrance off Alexander Street. People can come in. We've got a front desk where people can grab supplies, or if they have any questions about what we do here or what services we can provide here. People can check in at the our intake desk. Once they're done using, and they feel safe, they can choose to leave, or if they want to stay, we have an area for people to kind of sit and relax for a bit, have some coffee, something to eat.
We have tons of resources. We have a doctor that will give safe supply. We have outreach workers that can get people into shelters or treatment centers.
There's also like meetings for people to help them with their struggles. The list goes on and on. You should go to Purpose and just like look up all the wonderful things that they do.
Oh, I come here every week. I come to the peer support network. I love the people here. They're very kind. They're wonderful. They're very good people.
This is a great resource for people to use. I think with the poison drug supply, we don't know which drugs are being affected. So whether a person uses frequently or infrequently, they're at risk. And by increasing our awareness, we can help to reduce stigma and help increase other people's understanding.
Since I've seen the Safe Consumption site operate, I think it's been instrumental in preventing many deaths in the city. We, in our first responder community, lost one of our retired members last year to an overdose. So it's important for people to understand that it affects all walks of life, not just the at-risk population that are front and center in the streets of New Westminster.
I think the Safe Consumption provides a shelter in a storm for most of our clientele. It provides the opportunity to get out from out of the harsh realities of the drug usage on our streets, to come in and meet helping professionals that are there to listen. It's a starting point for that wraparound healthcare service for individuals.
Purpose is a great resource for anybody who is struggling and needs help. If they come and ask for it and truly want it, you get help.
Once they have some help, they will go back. They will go back for help because they know it's there. And if they know it's there, then there's a good chance that they can get well.
I think that you can come and talk to them about anything and they don't judge you. And I suffer from depression off and on through the years, and it's just nice to have someone to talk to, right? Yeah.
I was actually one of Purpose's very first clients, and so working here, it's kind of come full circle. At one time, you know, I was getting help from Purpose, and now I'm able to help people that are in need like I was.
We're a part of this community too. The staff here and the people who use the services here, we're members of this community too. We care about this community. We want New Westminster to be a better, safer place for everyone.
So that was the second video that we did for our anti-stigma work. Was there any questions that you guys had for me or Travis?
Thank you so much for the overview of services that are available. That was really super practical, and I think really going to be a good resource for community members who find this video, find this resource. Our series is really focused on employers and employers being able to support their staff members who maybe are struggling with addiction or who are using substances. And so I guess thinking about stigma and, you know, trying to open a conversation maybe for employers. I'm just wondering if you had any advice for employers who maybe want to let even their staff know about the resources that are available at Purpose. How would you recommend they just open a conversation or start talking about this in the workplace?
For me, the only thing I can really say is to just go into it with compassion and really meet people where they are. Not have any certain expectations that someone's going to necessarily use the resources or wants to. Just really meeting people where they are and treating everybody with compassion. Travis, do you have anything to add?
I would just add, like, don't be afraid to kind of to bridge that topic, to make that connection with people, to bring it up. You know, I mean, a lot of times people are sort of looking for a reason to kind of discuss their experience and what they're going through. Yeah, don't be afraid to kind of provide that a comfortable, safe space for people to do that. And yeah, like Sydney said, it's, you know, these are your coworkers and your friends, and they're no different from anybody else in your life, and just treat people with that humanity and kind of with the dignity that, you know, all kind of human beings deserve and expect. And I think people will kind of respond positively no matter what, if you kind of approach it from that perspective.
so much.
Of course.
I'm wondering if either of you can describe for people who are watching this how businesses can support the work that Purpose Society is doing in New Westminster. I mean, obviously they can donate, but are there other ways that they can support what's happening and support the community?
So just let people know about us and about the services that we offer. Like just you know, discuss kind of what we offer, the services that we offer here. I mean, the safe use, the witness consumption services that we offer here are a great resource for people who might otherwise be sort of using alone, which can be very dangerous at this time. Also, as I mentioned, the FTIR testing, that's a great resource for anybody who uses drugs on any level. For, I mean, people who are sort of casual users or only use on weekends or on certain occasions. You know, we're in the middle of a toxic drug epidemic right now, and that can be very dangerous, especially for people who don't use regularly, finding things in their drugs that they don't want. The drug testing that we do here is a really great resource for those people, and I think yeah, just promoting that to your letting people know about that, and that service is available here, and just that we're here and what we do.
Yeah, I agree with Travis on that, and like just to bridge your just have the conversations that may seem even uncomfortable at first, because you never know. Like Travis said, a lot of people use behind closed doors, and you might never know who would really benefit from like opening up a conversation. As well, if anyone's interested in learning more about Purpose or the community action team, what we are able to, or what we are doing, the projects that we're running, you're welcome to contact me. You're welcome to come sit into one meeting. And then never come back again if you don't want to. It's totally up to you. But yeah, it's open to everyone in New West, and it's a much bigger problem than just Purpose or just anywhere. So it affects everyone.
And if a business wanted some information or materials, like a poster or brochures, would they get in touch with you?
Yes, I have lots of information and resources. I get tons and tons of things emailed to me all the time, so I'm happy to share those, as well as maybe programs that might be running. And you know, we get a lot of like questions about our digital inclusion, especially, and like how people are able to donate to that and what they need to do, like how their device can be wiped, well, so on and so forth. So I'm happy to answer any questions like that for people.
Fantastic. And I also had a question for people who come in to use whatever service. Do they have to have identification, or can they come in and remain a little bit more anonymous?
All of our services here are completely anonymous. We don't check IDs. People don't have to provide any personal information that they're not comfortable sharing, and we don't share any information about people or about their use of the services here with anyone.
That's great.
Same goes. It's the same for the digital inclusion and community action team. People can give fake names if they want to. It's not. It doesn't matter to us.
That's great.
Thank you so much for the work that you're doing in our community and the support that you offer to community members and businesses alike.
Absolutely. Thank you.
Thanks for the opportunity to share this information.
All right, I'd like to introduce our next speaker, and that's Brad Davie. Brad has 29 years of experience as a clinical pharmacist and 23 years of experience in emergency response with New Westminster Fire and Rescue Services. These experiences include working in the emergency room at hospitals, working in critical care, and also responding to a variety of emergency incidents, including opioid overdoses. He is currently using his skills and experience to create initiatives and work to mitigate the consequences of the opioid epidemic for the City of New Westminster. Welcome, Brad. Over to you.
Thank you. On April the 14th, 2016, about 6 years ago, the British Columbia Public Health Officer declared the opioid epidemic a public health emergency. In 2016, there were 16 deaths in New Westminster due to opioid overdoses. Since then, several initiatives, programs, and strategies have been implemented to reduce deaths from overdose, such as harm reduction services, take-home naloxone, overdose prevention sites, phone apps to detect overdoses, new addictions clinics, anti-stigma campaigns, drug testing, and several other initiatives. Despite all of this, in 2021, we had 587 emergency responses and 42 deaths due to overdose in New Westminster. The most recent coroner's report indicated that 30% of drug overdose victims had made contact with healthcare services more than 10 times in their last 3 months of life. So this epidemic has become a large and unexpected burden on the fire department, British Columbia Ambulance Service, police department, emergency room, hospitals, and other social services. Likewise, the consequences of opioid overdose has resulted in increased homelessness, increased needle or drug paraphernalia debris, and human waste deposits in public places. So we have all these overdoses, all these social consequences, and our health services that have become overwhelmed. So who's overdosing and who is dying from these overdoses? Well, anyone can be, but we've noticed some common factors. Over 60% of overdose deaths are in people who have mental health disorders. Over 70% are in males. Most are aged 29 to 50. Most who died were using opioids alone when they died, and 73% are chronic users. Indigenous groups and homeless people are overrepresented per capita basis when it comes to opioid deaths. The most commonly affected workers of the working industry are construction and temporary labor workers, building service and waste management workers, and those who work in the hospitality industry. There's one last statistic that really jumped out at me, and that is that 75% of fatal overdoses occur in people who have never sought treatment. So now I'm going to move on to another presentation here to help you prepare for your work site for an overdose emergency. Okay. So how to prepare for an overdose. The objective of today's presentation is to get employers and employees prepared for an overdose at work and to get your work site prepared for any medical emergency, how to recognize an overdose, what to do when the overdose happens, how to treat the overdose, and what to do after the overdose. Before the overdose, a comprehensive plan should be created and the plan should be practiced. But first, the necessary equipment should be acquired by your first aid attendant, and it should include breathing aids, such as a breathing mask or a pocket mask, a take-home naloxone kit, which can be obtained from a community pharmacy or an overdose prevention site. The Towards the Heart website can tell you where these places are in your local community. The naloxone should be placed in an appropriate location that is away from heat or sunlight, and this location should be known by all staff. Naloxone has an expiry date, so I recommend that you place a reminder in your calendar for when it expires and that you will need to obtain a new kit. Next, create a system to alert your opioid overdose response team. This team will need to be able to call 911, know the address and response location for emergency responders to respond to. Ideally, you will have some on-site first aid attendants in addition to other people who can be designated to help out in an overdose. It usually works well if you can assign people to specific roles, and it can work very smoothly if this can be done in advance. When possible, 3 first aid attendants is a good number because this allows 2 people to perform first aid, 1 to document the activities, and support the attendants with getting supplies or drawing up the naloxone. However, 1 will do if that is all you have. Ideally, you would have at least 2 emergency responder greeters who wait at the location the emergency response personnel are responding to so they can guide them into the patient. 2 is a good number because these emergency responders often do not arrive at the same time. This allows 1 greeter to remain and wait for the second, or third emergency responder, while the other greeter guides the first arriving emergency responders into the scene. It is helpful to have someone plan an evacuation route if the patient needs to be removed in a stretcher and can't walk on their own accord, if the overdose happens in an awkward location within the construction site. Once the plan is in place, everyone should be taught the plan and their specific roles as well. Everyone should know how to alert and activate the overdose response plan. So what are the signs and symptoms of an overdose? The patient can become sedated, they may be unable to rouse them, or they may become completely unresponsive. They may exhibit slow breathing, such as breathing rate of less than 12 breaths per minute. They may have gurgling sounds associated with their breaths. Their skin may be cold and sweaty. Often their pupils are tiny. They may have a bluish tinge to their lips and their fingernail beds. These effects can happen because the opioid causes sleepiness and or slow or absent breathing. It is the effects of the breathing that we are most concerned about. If they are breathing less than 8 breaths per minute, then the person's life is in imminent danger. It is important to remember this because it is the guiding principle for everything we do and how we prioritize our actions. So when you come across an overdose at work, you should activate the opioid response plan that you've previously created and practiced. The first aid attendant should assess the patient and confirm there is a medical emergency and then have an assistant call 911. Your safety is most important, so before you do anything, you need to ensure you can help without risk to yourself. Remember to watch out for needles and remove any that are in the air before you begin your work. Do not reach into patients' pockets because there may be needles in the pockets if the person injects their opioids. There's a saying to help you remember what to do in an overdose. It is save me. This saying is inside the take-home naloxone kit. And it is there in case you need to refer to it as a reminder. The first thing you do is S, which stands for stimulate the patient. You do this first verbally by calling out to them, and then giving them a pain stimulus by forming a fist and giving them a sternal rub by rubbing your knuckles up against their chest or sternum. If they do not respond at this point, this is a medical emergency, even if the condition is not caused by an opioid overdose. Next, A is for airway. Now you need to manage the airway. Open up the airway, check the mouth, remove any debris or anything in there that you may see. Tilt the head back by lifting the chin. This ensures that air will flow freely into the lungs and the airway won't be blocked. V is for ventilate. If the patient is not breathing or is breathing at less than 8 breaths per minute or has a bluish tinge to their skin, then give the patient 2 back-to-back breaths. Then continue to give them 1 breath every 5 seconds until the patient breathes on their own or help arrives and takes over care. Breathing is actually more important than naloxone. If you did not have naloxone, you could not breathe for the patient. You could continue to breathe for the patient until the opioid wears off on its own. E stands for evaluate the patient. Check to see if the patient is breathing on their own and if the patient has a pulse. If there's no pulse, then you need to do chest compressions and breathe for the patient. M stands for medicate. You would use the take-home naloxone kit and administer 1 ml or 0.4 milligrams of naloxone. Continue to breathe for the patient after you give them naloxone until they breathe on their own or help arrives. I will explain how to give the naloxone later in this presentation. E stands for evaluate again. If the patient is still not breathing, then give a second dose 3 to 5 minutes after the first dose of naloxone. Continue to breathe, continue to check the pulse, and continue to check for breathing periodically. If the person starts to breathe on their own, but does not wake up, then place them on their side and continue to monitor them. So inside the take-home naloxone kit, we have some gloves for your protection. We have 3 needles. We have 3 ampules of naloxone, We have some alcohol wipes for skin preparation for injection. And we have a breathing mask. Naloxone comes in an injectable and in nasal forms. The injectable form is most commonly used in British Columbia because it is so much less expensive to acquire. Both start working 3 to 5 minutes after they're administered, and they last for 20 to 90 minutes. This is important to remember because some longer acting opioids like heroin or OxyContin can last longer than the naloxone. Occasionally in large overdoses, the naloxone can wear off before the opioid does, and the person can experience an overdose again, even without taking more opioid. It is important to remember that you are unsure if someone has overdosed, that it is safe to give naloxone, even to people who have not taken an opioid. If the person regains consciousness before help arrives, it is important to remain with them and to tell them what happened. Tell them they received naloxone and that it will wear off. Tell them to avoid more substances and that if more opioids are taken, it will be a waste because the naloxone will block their effect for a little while anyhow. Once paramedics arrive, tell the paramedics how long the person was unresponsive, any medical conditions the person has, what treatments you did, and how much naloxone was given and when. Also, after the incident, it is important to remember that this may be traumatic to other staff who are not used to dealing with life-threatening emergencies. Check with the staff to see how they are doing. WorkSafe has a critical incident response program which can help the employees who have experienced an emotional traumatic event such as witnessing a near death or a death of a colleague. If an employee is traumatized, then do not hesitate to contact WorkSafe and they will arrange for an appropriate service. Often they will have an experienced trauma counselor come to them. Okay, so how to give naloxone when you get to the appropriate place in your treatment of the patient. Remember, it can be very stressful to administer an injection of an emergency situation. If you have never done this before, there is a video that is intended to make it a little less stressful in the moment, but it is also recommended practicing this at least once if you can. You can visit the Toward the Heart website to find the location to get some of these teaching aids and get some in-person teaching and practice this, or to watch the video. Before you start, remember the most important part is to have someone breathe for the person if they are not breathing. If you are alone, if you are alone and they are not breathing, then do your best to ensure to stop breathing, to continue breathing while you are preparing the injection and to go back and breathe more and more for them throughout the process. Also remember that if you're not sure if the patient has taken opioids, it is okay to give the injection just in case. So now I'm going to flip out of here. Okay, so this is what a take-home naloxone kit looks like. On the front of the kit, you will have an expiry date. This is the expiry date that the kit will expire. Try to make sure that you keep track of that and always have a kit on hand. Inside the kit, we have the Save Me sticker right inside the kit to remind you how to treat a patient. We have 3 syringes to drop the naloxone into. There's 3 naloxone ampules inside a container to prevent them from breaking. We have a breathing mask to protect yourself from the patient, but to allow you to breathe for them. Some gloves to protect yourself. And then some alcohol prep pads to wipe and clean the skin on the patient. It's best if you can do that, but it's not mandatory. Also, if you can't expose the skin, it is okay to go directly through the clothing in this situation. So if you're going to give the naloxone, the first thing you do is you grab the naloxone by the top and swirl it around. This is to get the medication from the top of the vial down into the bottom so that it can be drawn up and isn't lost when you open the ampule. Hold the base of the ampule between your thumb and forefinger, the top between the thumb and forefinger of the other hand, and pull the top towards yourself briskly to break it open. Then you can place this down onto the table, grab one syringe. This is the plunger end. Open it from the plunger end by separating the two tabs at the top. You can grab the syringe like a dart, pull the cap off, place it on the counter. Then you're going to go into the ampule. Usually we do this on the desk so you don't risk a needle stick injury. And then you can drop the liquid. And normally you would do this down on the desk, but I'll do it up here. Invert the needle up. Tap it to get any air bubbles near the bottom up to the top. Slowly inject the air out. When you get near the top again, give it a good whack to make sure that all the air is removed. Then continue to press, inject the air up till a little bubble forms at the top of the needle. If this is being prepared by an assistant while the first aid attendants are working on the patient and they're not ready to give the naloxone, it can be recapped. Take the cap, place it above the needle, and let gravity fill it in. Don't force it down because you will risk a needle stick injury. Once it's dropped, grab the base and click it into place. Then you can set this aside until you're ready to use it. Grab an alcohol pad, tear it open on one end, and you'll get the alcohol swab. This is meant to simulate the person's skin. You would place the swab on the skin and wipe it in a circular motion, getting the circles larger and larger. Ideally, you'd like to wait until the liquid that you've applied is completely dried. It's the drying action that actually kills the bacteria. When you're ready to give the injection, hold the syringe like a dart, remove the cap. You can flip it around, hold it again like a dart facing the other way. Enter into the skin perpendicular with a brisk motion. Push it all the way in. Press the plunger in. You'll hear a click. Once you hear that click, remove the needle and confirm the needle is retracted inside the syringe. If the needle is not retracted, continue to push up the plunger and the needle will retract itself in the into the syringe. Remember to discard the needle, the ampule, and the ampule cap into a sharps container if possible. You can repeat the injection in 3 to 5 minutes if the patient hasn't responded at that time. For further information on this, you can see similar videos or more teaching aids, or where to get the in-person teaching, or where to get the take-home naloxone kits at the Toward Your Heart website. Thank you. I don't know how to end that. That's it. That go okay?
Yeah, it was great. Thank you. I have a couple of questions on the naloxone demonstration. So you mentioned, Brad, that you can prepare the syringe, but it doesn't have to be used right away. How long can you wait? Like, I'm sure eventually it wouldn't be good to use that syringe once it's been
in
prepared.
the hospital standards, 24 hours. So
Okay.
once we prepare a syringe, if we prepare it properly, 24 hours. If I was asked that in the community, I would tell them 10 minutes. And the reason is I wouldn't trust them to prepare it with proper aseptic technique. The real reason we put these time limits on is limit the time to grow bacteria. If I've drawn it up properly, I'm not going to, even if I drop a bacteria, it's a lot less likely. But if I draw it up and don't drop any bacteria, do it properly, the risk of that bacteria turning into something is slim to none.
Yeah, especially if you're in, like a workplace lunchroom, or if you're outside, like there's a lot of opportunity for bacteria. It's very different than a hospital setting.
Yeah, for sure. That's a good rule of thumb would be 10 minutes. Thank you for that. The other thing that you mentioned that I'm interested in, you said it's safe to give naloxone to someone who hasn't taken opioids. And I'm just curious if you could let us know what would happen for people watching. What would happen if you gave naloxone to someone who didn't take opioids, hadn't taken?
Somebody was completely opioid naive and had never taken opioids in their life, and they were administered naloxone. The only risk to them is associated with the injection itself. So injections can cause pain and redness at the site. It can cause infection at the site, problems like that. Usually small and limited localized infections. There is no risk from the naloxone itself. What it does is it binds to what we call mu receptors in the body and blocks opioids from binding into those mu receptors. Because there is no opioid on board, if the person is not an opioid user, there's nothing to block anyhow. There's no clinical effects.
Great, thanks for that. Jen, do you have any questions?
Yeah, what could a person expect to see if the naloxone's working? What would the patient start doing, or how would they act? Is it sudden, or do they kind of come out of it?
They do start to come out of it. It's not that sudden. If they're not breathing at all, what you'll usually start to notice first is they start to breathe on their own. And you'll notice that as you start to breathe for them, they'll be resisting your breaths and they'll be forcing breath back upon you. Once they start to breathe on their own and they're breathing at an adequate rate, they don't necessarily become conscious right away. You continue to monitor them. You roll them over onto their side in case they vomit, so they keep their airway clear. Continue to watch them. And eventually what will happen is just they'll start to wake up. They go from quite a sedated state to an awake state in a very rapid time frame, but they may be confused. So they'll suddenly be asleep and then they'll be awake and start to move around and look at you and speak to you, but they may be a little confused. Often they'll deny even having taken an opioid, and they won't even be aware that they were unresponsive.
And should a person still seek medical attention even if the naloxone did what it was supposed to?
Yes, anybody that is recovered from an overdose should seek medical attention. Not everybody will consent to that. The reason is if they have taken a long-acting opioid, they may go down again and be overdosed again if they've taken quite a large overdose. There is still that risk. If somebody doesn't consent, just the fact that they have overdosed is not adequate enough for us to force them to see medical aid, but you should advise them that they should seek medical aid.
Mm-hmm. And is naloxone available to business owners for free so that they could pick up the take-home kits? I know you mentioned that you can get them at the pharmacy. Are they free of charge?
Naloxone kits are free of charge to the public. If you're going to obtain 1 or 2 naloxone kits for your work site, you would be able to obtain those free. If you're going to be obtaining large amounts of naloxone, or if it is known that it is for industry, then it is expected you should pay for it. Okay. The naloxone is not very expensive. It's pretty inexpensive, relatively speaking, to some of the other drugs on the market.
And are you able to get just like a refill for the kit, or is it like you get the whole kit each time?
Usually you get a whole new kit each time. The kits have expiry dates associated with them. All 3 ampules have the same expiry date. They're all packaged to be used all at once. You can purchase individual ampules of naloxone, but the other supplies in the kit usually need to be replenished at the same time anyway, because it is designed for 3 doses. You're not going to use a breathing mask on a different patient, and usually the gloves are only intended for one-time use anyway, if you do use the gloves. So usually we'd get the entire kit replacement all at once.
And is there any worry about, I know in some of our job sites, we've got some relatively young workers. Is there an age, I guess, restriction on the young end of things that a business owner would need to be concerned about? Is a teenager okay to receive naloxone?
Anybody of any age can receive naloxone. You might use a smaller dose, but if somebody's old enough to be working on a job site, they're old enough to receive a full dose of naloxone that we have here. You can't overdose anybody on a naloxone. The biggest risk, if somebody is an opioid user and you give them way more naloxone than they need, you do put them into withdrawal. They may get a little agitated. They won't feel very comfortable, but there's no harm, no long-term harm to life or any risk of loss of life. We'll even use naloxone in a newborn infant who's born to a mother that was heavily using opioids. So there is no age restriction for naloxone.
That's great. I just have one more question, if that's okay, Brad. Just thinking about at the beginning, you said, you know, your best advice to a business owner or to maybe an employer is to create a plan and for overdose and then practice that plan. So where should people start? You know, if that feels like a daunting task to undertake as a business operator, what advice would you give them on, like, what is the first step? What should they do first to get that plan started?
Well, the first thing you want to do is get the supplies that you need. And probably the person you should engage to help you to create your plan is your first aid attendant. Your first aid attendant likely has a similar plan already in place for how he's going to deal with other emergencies, but he may or may not have take-home naloxone or naloxone kits available to him. Once he does get that naloxone kit available to him, that might be all that he needs for his plan. If he hasn't developed a proper plan, the next thing he should be looking at doing is, once there's an opioid overdose, how am I going to alert all of my helpers that I need? He's going to want to have somebody help him give first aid and maybe even assistant if there's enough people available. And he's going to want somebody to greet the first responders and to create a pathway back out for a victim if need be. So what he needs to do is decide who is going to help him do that, collect those people together, decide on who's going to do which role, teach them each their role, make sure they understand the responsibility, and then create some form of alerting system. Sometimes in a construction site, that's an air horn. The confusion with an air horn is that sometimes they use that for other emergencies as well, so it might not be clear what it's used for. So they need to come to some form of agreement on, maybe it's 2 blasts of the air horn or 3 blasts of the air horn or some other method. Maybe there's a cell phone text that's sent out, but they need to figure out how they're going to communicate to everybody so that they can carry out their roles.
That's great, thank you. And while we were talking, I looked up the Toward the Heart website. So just to let everyone know who's watching, that's Toward, TOWARD, theheart.com, and you can find resources on naloxone and other things that Brad talked about there. Towardtheheart.com. All right, thanks, Brad, for your presentation and lots of great practical information. We really appreciate it.
Oh, sorry.
I'm pleased to introduce our next presenter, Colby Young. Colby has received a Bachelor of Social Work and a Diploma in Public Sector Management from the University of Victoria. His prior experience supporting members of the community in Victoria living with homelessness, mental health disorders, and addiction has grounded Colby's approach to his work along the principles of harm reduction. Though new to the construction industry, Colby has witnessed the impact that the current overdose epidemic has had on our local communities. As the program lead for the Tailgate Toolkit, a new provincial harm reduction initiative, Colby works to build upon the skills and capacity of our industry, teams, and leaders. Colby, over to you.
Thank you, Jennifer. Yes, as mentioned, I am the program lead for the Tailgate Toolkit, which is a new initiative started originally by the Vancouver Island Construction Association here on Vancouver Island. But thanks to continued funding from the Ministry of Mental Health and Addictions, as well as, through their Community Action Initiative, we've been able to actually launch this project across the province with partnership from the other construction associations seen on your screen. So today I'm going to talk about a few things that kind of surround substance use, particularly within the construction industry, and how we can best, as leaders within the industry, address this in our workplace. Now, a quick reminder of what we're currently experiencing. We are in the grips of an opioid epidemic. This is a public health emergency that was launched in 2016. At the time of recording, we're actually about, I think a week out from the 6-year anniversary. And in that time, we have unfortunately lost nearly 9,000 British Columbians to drug poisoning. Now, I'm going to take a quick note in terms of language. I like to use the language drug poisoning as opposed to overdose. Overdose really implies that somebody has taken too much of one substance, resulting in an overwhelming of the body, when in fact, we are seeing poisoning. We are seeing that people are taking a substance, expecting to get one thing, and are finding that it has been cut with a synthetic opioid called fentanyl. So for that purpose, you will likely hear me use drug poisoning as opposed to overdose. Now, this number is tragic and incredibly startling. And our project comes not just in response to this public health emergency, but in response to some statistics that were launched in a report by the BC Coroner Service in 2018 that found that the majority of people who were employed at the time of death due to drug poisoning were members of our industry, so construction, trades, and transport. Now, this number up to this date remains consistent. It is the majority of people employed. And the truth is that this is for a number of reasons, many of which we could likely think of off the top of our heads. But luckily, we asked the people who know. In the spring of 2021, our project staff spoke to members of the construction industry on Vancouver Island, a number of whom had lived experience with substance use, some identified as being in recovery, and others were leaders in the industry, either employers or foremen, superintendents who had lost somebody. So everyone we spoke to had a connection to this issue. And we asked them, why is this happening in the industry? So we got a number of answers. Workplace culture. We know that there is a long legacy of our industry with substance use. What we often see is that it's a culture of work hard and play hard. After a long day of work, our staff may go out to a pub, share a few drinks. Nothing wrong with that. However, we consistently heard from those people that we spoke to that cocaine became a part of this after-work tradition and really became a part of the lifestyle. Now, this isn't consistent across all companies. However, it is something that was brought up a number of times, and we have heard consistently through our conversations ongoing with members of the construction industry. Feeling undervalued was also mentioned. Many of our staff may feel that they are a cog in a much larger machine. And this is a result of a few things. We do have very tight deadlines in our industry, and often we don't make time for the individual. We also are project-based. So you may find that many members of the industry get dropped between projects. So their work is inconsistent. And it's tough to feel value when that's the case. Now, this had real consequences for the people that we spoke to. Those who identified as being in recovery found that the likelihood of reaching out for help was greatly increased if they felt that their employer valued them. However, it was significantly decreased if they felt that their employer didn't. They felt simply that they were part of the machine. And something that we really have to keep in mind is valuing our staff so that they do reach out for help. It's exhausting work. I think that goes without argument. This is tough work. Hard labor, day-to-day, long hours, tight deadlines. For many, that resulted in use of stimulants such as cocaine in order to either have the energy to make it through the day or to enjoy life outside of work. Pain, again, goes without saying. We understand pain is actually just a part of the industry. You're likely to experience either an injury or just wear and tear on your body. And for many people, we've heard the story that they get injured, they receive a prescription for a painkiller, and from there, they may develop an addiction. But we also know that many people self-medicate for their pain. And this could be in the form of illicit drugs, it could be marijuana. However, we know that substance use for many starts there. And lastly, expectations of toughness, or this has also been phrased as expectations of masculinity. This is what we heard from every single participant that we spoke to in our initial interviews, that our industry values your ability to grind through pain, to work through it, and to continue your work. And in all fairness, that is something that is often expected across many industries, but this expectation was almost more pervasive than any of the other things mentioned, in part because we are such a male-dominated industry, which had real impacts for women as well. And just simply the nature of our work. And, well, I guess the stereotype about construction workers, we're tough. However, this presented a real barrier to reaching out for help, because many felt that to reach out for help was to show weakness, something that was highly stigmatized. And that brings us to our next point. We need to address stigma, because stigma is, without a doubt, the largest barrier to promoting help seeking. So what is stigma? Well, it's our beliefs and attitudes, typically negative beliefs and attitudes towards a particular group of people or an activity. In this case, it may often be substance use or people who use substances. We all likely have some type of bias or worldview or perspective that perhaps does look negatively upon this. And for many, for very valid reasons. However, as part of a promotion of support within our workplace, we need to tear down stigma in some way, because stigma, again, is the largest barrier to people accessing support. The importance of this is that stigma has other real consequences. People experiencing stigma, perhaps due to substance use, will experience discrimination, disrespect, fear, lost opportunities, isolation, difficulty seeking help, reduced self-worth, and high-risk behaviors to hide use. Now, this one I want to focus on because it relates exactly to using alone. Now, we know from that 2018 report that I mentioned that the majority of people who use and who died were found alone. They had been using alone. Using alone has incredibly tragic consequences because there is no one there to call paramedics if you need help or administer Narcan if you go down. However, when asked, why do people use alone? We likely all have the same answer. They're embarrassed or they're ashamed, that they want privacy, that they can't reach out for that support. So what can we do? Well, we need to create space where people can reach out for that support. So let's talk about reducing stigma. I want to talk about this in the context of our workplaces and what we can actually do. Education. Much of stigma is based around misunderstandings about the issue and about substance use. One of the biggest ones being that it's a personal or moral weakness. However, with education, we can better understand that there are many contributing factors to substance use, particularly substance use disorder and addiction. Now, greater education around this can ensure that we have a greater capacity to provide support, but that we also look at this issue differently, allowing our team members to identify that this is a safe place to actually access support. So, how can we educate people in our workplaces? Now, of course, I will list out a few things that we've heard from people in our industry, because we already have a lot of built-in means to provide education, perhaps through safety meetings or toolbox talks. A toolbox talk is a great way to talk about one of these issues. It's a face-to-face conversation with your crew. So it's an excellent opportunity to spread awareness about the toxic drug supply and talk to your team about supports that are available perhaps through your benefits plan or locally. Just talking about this can be an opportunity for people to start a dialogue and understand that you are someone that they can talk to. Other ways that we can provide education, we can provide training to our supervisors. We could provide perhaps onboarding training to new staff or training upon review. Opportunities for people to simply gain a bit more understanding of this issue because it is incredibly complex. And the truth is, many of us may have misconceptions. Exposure. These misconceptions can really be sorted out simply by speaking to somebody who has lived experience. Now, this is something that can be difficult to bring into our workplace, but there are a few ways that we can start to address it. Perhaps you yourself have lived experience. If that is the case and is within your means and comfort to self-disclose and talk to your team about your own personal journey, that can be an incredible form of exposure for your staff because they'll know this person's been through it, they get it. Other opportunities may be reaching out to local service providers. Some agencies do provide peer support workers, many of whom do have experience in construction, who may be able to talk to your team. Other opportunities may be to incorporate videos within your training. So it could be some short documentary clips from people with lived experience discussing what is happening with them or their journey throughout this process. Exposure is just one piece of reducing stigma, but it's certainly something that we can look to do. Oh, and lastly, actually, I heard about a great option for this just today. One company described that each year they do a volunteer day where they go into their community and they volunteer, perhaps with a soup kitchen or handing out supplies to people who are unhoused. This is a great opportunity to also gain exposure to people with very different lived experiences and shed some light on some of the misinformation that we have. Reflection. Ultimately, stigma starts with us and our own personal views. So it's always important that we look internally and understand what we may be bringing into the workplace, because this is a professional setting. Many of us are leaders in the industry. We will be the ones providing support to our staff. It's important that we leave any stigmatizing views at home. They don't have a place on the work site. This is a place to really provide support. And communication. How we communicate can be stigmatizing. The use of labels, such as addict or junkie, can be incredibly stigmatizing. And in a professional setting, there is really no purpose for it. So we need to change how we use our language, moving from stigmatizing language, such as those labels, towards person-first language. Now, person-first language is as simple as it sounds. It puts the person before the condition. So, for example, instead of saying drug abuse or drug abuser, we can say substance use or person who uses substances. A drug habit can be regular substance use or substance use disorder. Again, addict or drug user can be a person who uses substances. Now, there's other language as well that we can start to apply. Referring to somebody as clean, we could change that to being in recovery. Suffering from or struggling with is also something that we commonly apply to people who are experiencing addiction, when in truth, that implies that they are living a subpar life. In fact, we could simply say that they are living with or experiencing addiction or substance use. And of course, labels such as crazy, when it's really a person with a mental illness or a diagnosis. Now, these are pretty broad examples, but it makes a difference. For example, and I heard this actually recently from somebody who is in recovery and worked in construction. When they were on site, still really dealing with their substance use and were uncomfortable reaching out for help, they heard people on their site talking about somebody who was unhoused on the street, and they refer to that person as a junkie. and an addict. And that person described it to me as simply being, I knew then I could never talk to them about this. How we use our language has real consequences. And this is not intended to sterilize your language or make you sound like a robot. However, we do have to address the real implications it has and understand that we are still in a very professional setting and that this does have repercussions. And of course, stop it when you see it. In that example where somebody is having a conversation using such labels as junkie, it's as simple as intervening and saying that that's inappropriate for the workplace. Just stopping it as soon as it starts sets an example. As leaders in the industry, it's something that we have to do. It can also be taken a step further. Perhaps this is a great time for a little education. Maybe then you can follow up with a toolbox talk. But it's important that we address it and we stop it as soon as possible. Not wait to handle it privately. This is something that needs to be stopped really as soon as you can. Now, all of this goes towards creating a culture of support. And I'm a big fan of this term, culture of support, because I find it is so intuitive and so complementary to a culture we already have within this industry, which is a culture of safety. Safety is huge in construction. It's so much of what we do is based around safety. And this is simply a part of that. However, it does kind of contradict a culture we've already mentioned, which is one of toughness, because we are asking people to be open, be vulnerable, and look for support. Additionally, we're asking you as leaders to step up and be vulnerable and provide that support. So, how do we communicate to our teams that support's available? Well, there's a few ways. It can be easy as checking in. Just saying hi to people and asking how they're doing. It doesn't take much more than that. However, it's something that on many sites is lacking. Continued communication with your team is vital. Communicate what is available in their benefits or employment assistance plan. I don't know about you guys, but when I started this job, I received information about my benefits on day one. I didn't need them for months. I have no idea how to access them, and I'm not even sure what's in there. I hope good things. But it's something that many of our sites really come up against. Many people don't know how to access their benefits or what's available to them. Making it clear to your staff how to access it, even after that day one initiation, is really important and can be done just through having posters or routine emails that go over that information so that people can continue to access those supports without going through the potentially stigmatizing process of asking. Education, can't say it more. Continue to educate your teams and inform them of what supports are available, either through your company or locally. Be available yourself. This is very difficult in our industry. It's incredibly busy. We have very tight deadlines. However, if you can't be available all the time, make it clear to your team when you can be. If you have routine hours where you can have open door or just those are your office hours, make it clear. That can be through posters, emails, or just checking in. Have information available. Have an information station. If you have supports in your area, perhaps harm reduction supports like overdose prevention center or drug checking services, have that information available. Perhaps you have some crisis lines in your area. Have that available. This can be on your Josh board, it can be on a table in your site office, but having that information available ensures that people can access it, but also goes towards my final point here, which is messaging and signaling. All of these work towards a greater goal of really letting your team constantly know through routine messaging that they have supports available, that you are there to listen to them and provide supports, that that you want to be there, that this is something that your company encourages. So putting all of these things into place can really promote this support and hopefully break down that wall that prevents people from reaching out for help. And this will be my last point before I talk a bit more about our project. I'm often asked by people in the field, typically supervisors, how to recognize the signs that somebody is dealing with substance use, perhaps a mental health disorder, perhaps something else. And the truth is, I could not possibly tell you all of the signs in this presentation. I wish I could. The truth is that there are a variety of signs that somebody is using, depending on what drug they're taking, depending on how much they take, depending on when they take it. And many of those can also look like various disabilities, various mental health disorders, injuries. It becomes incredibly complicated. So I have one piece of advice when it comes to recognizing the signs. Know your team. It's much easier to look for changes in behavior, attitudes, quality of work, and the impacts on their life than it is to simply look for the odd sign of substance use. So get to know your teams, those daily check-ins, routine meetings, emails, anything it takes to really get to know them. And maybe you have somebody on site who does have a better relationship or rapport. Many of us aren't on site every day, so it's important that we have people who can potentially do this recognition themselves. If you would like more information on the various signs of substance use, we do go into this a bit more in the training that we provide through the Tailgate Toolkit. But like I said, this is typically the best way that you're going to be able to identify if somebody needs support. Get to know them. Now, if you'd like to access some supports for your work site, I do recommend going to our website, thetailgatetoolkit.ca. We can provide those toolbox talks in which we discuss the current state of the drug supply, the opioid epidemic, what supports are available, and just where you can access more help. We also provide training for supervisors. We also have print resources. So these are brochures that actually have a list of service providers in your region, including your health authorities, mental health and substance use offices, safe injection sites or safe consumption sites, drug checking. All this is available and it's regionally specific. Additionally, we have an industry-specific support group. It's called Hammer Time, meets every Thursday night over Zoom from 7 to 8. And I saw some people laughing at the name Hammer Time. I didn't pick it, but I love it. So these are all ways that we want to provide support to you who are taking on this work of challenging stigma in your workplace. This is all free of charge and all something that we provide across the province. So please, if you're interested, access the tailgatetoolkit.ca. Now, would we like to go to questions?
Thank you so much, Colby. I don't know if perhaps you want to take down your shared screen.
Absolutely.
And then we can go to any questions that have come up. Now, because this is pre-recorded, Jennifer and I will be the question askers. Jennifer, is anything off the top of your head right away?
I guess maybe, and the presentation was really comprehensive, Colby, so thanks for that. I guess maybe if we're thinking about leadership in the industry and employers, and I really liked that idea of noticing a change in someone, and that instead of trying to spot signs or no signs of substance use, looking at something's different. So if you do notice on your team that maybe someone is behaving quite differently, or you do notice a change in someone and you're concerned, what would be like a good way into starting that conversation? What advice would you have for an employer to kind of open a conversation with someone even if you don't know what the issue is, maybe it's better to have an open question. But anyway, what advice would you give to kind of starting that dialogue?
I would typically advise doing a bit of a check-in where you acknowledge, I think the acronym that I've used before is ACT. So ACT, acknowledge the change, come from a place of concern. So express your concerns and talk. So leave space for that person to talk it out. Because you're going to, I mean, depending on the change that you notice, there could be real safety implications on your site. It's something that you're going to need more information about. So in a way, you're somewhat confronting them by saying, hey, I've noticed that this is happening, and definitely have specific examples so that it's something that's harder to deny. Express your concerns. I'm concerned that you may be going through something. And at this point, you may want to ask an open-ended question. So this may be, is there anything I need to know? You're going to want some explanation for the change of behavior. Make sure it's out of concern, but ensure that you do get a response that is satisfying, or if you feel that's not, there may be a chance to follow up. If there is a safety concern, then perhaps you may have to actually confront them a bit more directly.
I think that's really helpful. I like that acronym of ACT.
Thank you.
I have a question about your industry-specific support group, Hammer Time, which, yes, definitely, that's a great name. But I was curious, is this something that just, one of the things we have in New Westminster is a number of workers who are temporary workers who work for temporary labor force. And I wondered if that's something that they could attend, like if just a random worker wished to attend, they don't have to kind of come through any special channel, they can just show up.
Absolutely. So this is a virtual group. It's over Zoom, but it's open to anybody who is in trades, construction, transport, forestry. The truth is, it's a very open group. You know, it's not a 12-step program. It's not faith-based. It's not abstinence-based. It's really just a place to connect with people who are going through a similar thing to you. So yeah, absolutely. Anyone who is interested, who has some experience in trades, and these other kind of aspects of the industry, please sign on, give it a shot.
That's fantastic. Another piece I was curious about was around a lot of our job sites have multiple employers involved. So you've got, your GC, and you've got all these different people. If you've got a scenario where you recognize that someone else's employee has either changed behavior or is doing something in a way that, kind of makes you stop and think, any sort of tips for approaching that? Should you be going to the employee? Should you be going to their employer? Is there any kind of an idea in that kind of scenario?
I think it would predominantly be a bit of a case-by-case basis, depending on your rapport with that individual. It may be that you can have that very more casual conversation about, hey, what's going on, utilizing the ACT acronym. But this is also going to be whether safety is a concern. And in the case where safety is a concern, it may be that you either directly have to excuse that person from site, and that's something that as a GC you'd be able to do. However, if it's not as immediate a concern, then absolutely go through the employer. Ultimately, it is something that they're going to have to address. So it's a chance to really collaborate with them and maybe have a broader network of support for that individual.
Yeah, great tip. Great tip. Jennifer, did you have any other questions?
Nothing's coming to mind for me. That was I really appreciated the content on stigma, and I think that's something that applies to all industries and all of us as people, as we kind of think about trying to improve the situation with the drug poisoning crisis, for sure.
Yeah, I really appreciated the comment about making sure that employees know about benefits that are available to them, because yes, we all get it at our orientations when we start a new position, but it's easy to forget what's available. So I do appreciate the idea of reminding that there is support available, especially for those of us who may have been on the job for a long time. So
It's true. I mean, years ago, I actually experienced burnout while doing frontline work. And it was a counseling service within my benefits package that really helped me out. It allowed me to return to work when I was ready. And I definitely really promote benefits. Benefits are something that we can all, when we have access to them, should utilize them.
yeah, I think so. Use them while you have them, right?
Yeah, true enough.
Well, I just want to say thank you very much for sharing with us. I think that's great, and I do hope that people who are watching take advantage of the resources available on your website.
All right, I am very pleased to welcome our next speaker, and that is Tyler Weatherup from Fraser Health. Tyler is a regional harm reduction coordinator with Fraser Health. He has more than a decade of experience working with people who use drugs at various community-based nonprofits. As a person with lived experience, Tyler brings a unique perspective when developing programs to support people at risk of overdose, and he's passionate about community engagement and drug user wellness. Thanks so much for joining us, Tyler, and over to you.
Yeah, thanks so much, Jennifer. Thanks for having me here today. Really happy to be presenting in my home community. It's nice in a regional role when I'm able to contribute to the community where I live. So very happy to be here today. So I'm going to be running through a presentation that's going to just give an overview of substance use in general and sort of who uses substances and why that is sometimes stigmatized and what outcome that can cause. And then we're going to go into talking about services that are available across the region for people who use substances, depending on what their goals might be. So I'm just going to share my screen. There we go. Oops. All right. So before we get into it, I think it is important to do a land acknowledgement, recognizing that I do work, learn, and live on the unceded traditional and ancestral lands of Coast Salish and the Kakite First Nations, and I'm privileged to be able to live here. So we want to start off just by talking about sort of why people use substances. I think it's one of my colleagues talks about this need from childhood, from when we used to spin around on the tire swing or spin around until we threw up. And it was this early desire to want to dissociate from reality. And I think that continues into adulthood. So many people use substances to feel good, some to feel better, some to do better, and some to explore. So to feel good, stimulants may lead to feelings of power, self-confidence, increased energy, whereas depressants tend to provide feelings of relaxation or satisfaction. To do better, increasing pressure in a very competitive landscape means that people sometimes use substances to enhance their performance. And many people use substances to feel better. I don't know if there's a better feeling in the world than a beer at the end of a long week. Or people use it to deal with reduced symptoms associated with trauma and depression. And some people use it to explore. Some folks just have a higher need for novelty or maybe more risk adverse, and they want to discover new experiences or feelings. So the spectrum of substance use, as you can see, is quite broad. With sort of non-problematic use on the left and problematic or chronic dependence on the right. So what I described in the previous slide is typically what most people would experience when using substances. Beneficial use includes positive health, social, or spiritual effects. And these might include medical pharmaceuticals, coffee or tea, moderate consumption of alcohol, or spiritual like peyote. And then casual and non-problematic use is a few beers on the weekend, sometimes a few dozen beers over the weekend, but generally has non-problematic effects. And then problematic use is when use becomes perhaps a little bit more frequent. You may be administering it by different routes, and you may start to see some consequences, such as an impaired driving charge, binge consumption, and other flags. And then at the far end of the spectrum is chronic dependence. And this is when use has become habitual, compulsive, and often results in negative health and social effects. So how do we get there? Because most people who use substances start off on the beneficial side of the spectrum, using to either manage pain, feel good, explore. How do we get to this area of chronic dependence or problematic use? And a lot of that is rooted in the stigma and shame that's associated with substance use, particularly illicit substances. And Alexis Crabtree is a doctor, previously working with Fraser Health, may still be working with Fraser Health. And she describes the cascade of loss really as sort of the chain reaction that happens when somebody's outed, for lack of a better word, as a substance user. And typically, that means that all of the supports that are sort of visualized in this slide, such as housing, employment, family, healthcare, reputation, are all at risk of erosion when somebody's outed as a substance user. And it doesn't have to be that way, because most people, without feeling shamed or stigmatized for their substance use, wouldn't progress sort of along that spectrum towards problematic use. And this is just a really nice quote from her talking sort of about expectations, I guess. And so we as public health officials want people, if they're going to use drugs, to do it with others around. But how can we expect them to do so when their drug use is so heavily stigmatized? Of course, people use on their own, in secret. Of course, they don't want to access overdose prevention sites when there's one available in their community. And of course, they don't want to call for an ambulance if they do witness an overdose, because the attention from that invites stigma and, more importantly, discrimination. So I often use me as an example in how the cascade of loss could really affect somebody. So right now, I'm married, I have a great job, and I have a supportive partner, and I have a really good support system, and I have fair and equitable access to the healthcare system. But if I were to come home one day and tell my partner that I had actually been using cocaine on the daily to better perform at work, feel more confident in my routine, he'd be concerned. And he, even knowing everything that I do in this work, would probably react in a way that was not supportive, which probably wouldn't encourage me to continue being honest with him about substance use. And if that happened, that could put our relationship at risk. I may start using more substances to cope with the stress and anxiety of not being honest and truthful, which could impact my job. If I lost my job, we could be in financial disrepair. And so that cascade effect can actually take place pretty quick, and it can happen to anybody. Nobody's immune from that. So how we show up and how we respond to people who trust us to talk about substance use, who want to be open, is really the most important piece in not sort of triggering that cascade of loss. So how do you show up for people who use substances? Well, acknowledge it, and acknowledge that their life is still valuable, regardless. Acknowledge the benefits that substances provide. If somebody comes to me and says that they're needing to use illicit drugs to complement a pain management care plan from their doctor, I'm going to assume that that person's in a great amount of pain, and that those substances do provide the therapeutic benefit. Talk about it in a non-judgmental way. Sometimes offers for support can imply that the substance use habits need to change. If the first reaction or response that you give is that, well, there's help available, or we can get you this, then you're really devaluing that person's worth for where they're at. And reflect on success for people. Who defines success? Many people who use substances don't necessarily want to abstain from substances forever. They want to have a relationship with substances that doesn't impact other areas of their life. Very few people actually strive and maintain a sort of 0% substance use rate for life. So really thinking about who sets the goals and how you can support somebody's goals, even if they differ from what you might think success would look like. And be careful of subtle messaging that you might be giving people when they tell you that they're using. So I'm very bad for facial expressions. I often can't hide how I'm truly feeling. And I know for a lot of people, if they were to find out that somebody very close to them was using substances, or an employee, they might react in a way that's shocked. They might react in a way that shows disgust. They might react in a way that's very closed off and from a position of authority or power. So really making sure that when you're having those conversations with people, you're being mindful of how you're presenting in the room. And it's not enough to just know the resources. And I think that somebody who is connected to somebody who used substances problematically is very good at brushing up on treatment centers and recovery groups and Alcoholics Anonymous and things like that. But that's just one piece, and it might not even be the piece for everybody. So you need to be able to keep people engaged and connected throughout their journey. So we'll move into services that support people who use substances in New West and across the Fraser Health region. And it's really sort of presented in 6 prongs of care, I guess. Short-term community intervention and support, bed-based treatment services, addiction medicine and specialized supports, connection and navigation, health promotion and prevention, which includes many harm reduction practices, and then withdrawal management. And before we get into the details, we'll just look at sort of how substance use services philosophy and approach has evolved, specifically over the last couple of years. It's really changed from being more abstinence-based to being harm reduction and substance use management. There used to be a thing that like a client had to check all the boxes of a program, but programs have actually changed to be more person-centered and responsive to clients' needs rather than making them fit into the program mold. We used to consider substance use a moral failing. I think that's still out there a little bit, but I think in a professional context or from a support service lens, we recognize now that most behaviors, including problematic substance use, are a result of diverse forms of trauma, which can include being stigmatized. We've moved from clients needing to say they're ready, you know, they've hit rock bottom, they're really ready this time, to offering the least barrier response, regardless of motivation, in an effort to reduce harmful effects. There's a highly toxic drug supply, so any interventions or steps that we can take that are low barrier are helpful. Substance use service and mental health services used to be delivered in silos. Back when I was a caseworker, this was a very frustrating piece that a doctor wouldn't treat somebody who had co-occurring mental health and substance use because they couldn't establish a baseline, and that has started to change. And they just recently opened a Redfish Healing Center in Coquitlam, and it's the first treatment center, I believe, in the province, certainly in Fraser Health, that actually treats mental health and problematic or substance use disorders at the same time. And opinion-led practices have shifted to evidence and research-based practices. And clinicians aren't the only experts anymore. They're still certainly experts. We don't want to devalue the knowledge and experience that they bring to a care plan, but they're starting to include clients in the care plan too. So for connection and navigation, services available in Fraser Health include the Substance Use Services Access Team, which is SUSAT, and they provide support and navigation to substance use services. There are peer support networks. So Mom Stop the Harm is a good example of a mutual aid group that can provide support. We also have drug user networks, which are peer-based organizations that seek to help with the rights of people who use drugs. So the big one is VanDu in Vancouver, was sort of the original peer-based organization, but there's some like Drug War Survivors that are in the Fraser Valley now. And new to Fraser Health is the Overdose Outreach Team. So this outreach team, a multidisciplinary team with nurses, peer support workers, and outreach workers. Primary goal is to increase connection with community and promotion of drug user wellness. So they're not meant to connect people with treatment. They're not meant to get people on opioid agonist therapy. They're simply there to meet people where they're at. And we have a team in the north and the south and the east. So that's very exciting for Fraser Health. For health promotion and health promotion and prevention. So harm reduction services been around for a long time now, available at public health units across the region and contracted service providers. So that includes the Starship Health Contact Center in New Westminster at the Purpose Society. And they provide distribution of clean supplies, safe sharps disposal, take-home naloxone training, education, and some offer overdose prevention services. Drug checking and fentanyl screening, fairly new to Fraser Health, has been around in Europe for a long time at the festival scene, mostly for people to check sort of what's in the drugs that they're about to take. It wasn't really a problem up until 4 years ago when the street drugs became toxic and poisoned. So in New West, we have Purpose Society that has an FTIR machine available to actually give a breakdown of what's in the substances. And then we also have fentanyl screening strips, which is a really great tool for people who may just be using illicit substances in a very casual, non-problematic way, who just want to make sure that what they're taking is what they're taking. So two very, very important and effective harm reduction techniques to prevent the risk of overdose. And for withdrawal management, so most people are familiar with Creekside Withdrawal Management Center, which offers beds for youth and adults who require medically supervised withdrawal management. So not all substances require medically supervised withdrawal. Alcohol and benzodiazepines do. So Creekside is a good program for people who are trying to get into an abstinence-based program who may need to have a period of detox before that. And then we have the low risk withdrawal management at Maple Ridge Treatment Center further east with beds for youth and young adults aged 18 to 24 requiring less intense withdrawal management with limited medical supervision. For short-term community intervention and support, a lot of services you can access. The crisis line is one that many people are familiar with. Provides immediate, free, and confidential emotional support, crisis intervention, and community resources. I actually find the crisis line can be a really effective tool for people who've just been maybe shocked that somebody very close to them is going through problematic substance use. I think that we often don't recognize that can be a traumatic experience, hearing that if a loved one, a child, a coworker, or any of those groups. That's a great service. There are day, evening, and weekend programs for youth and adult. We have overdose prevention sites, including the fixed site at the Starship Health Contact Center in New West, and various other ones across the region, including some mobile OPS in the Fraser Valley. They provide a clean space for people to use their own substances, and then of course have fully trained staff available for overdose response when necessary. Overdose prevention sites are effective, like with a capital E. Anybody who uses substances should consider using an OPS if they are at risk of overdose. So people who are at risk of overdose include people who are maybe new to using a certain substance, they're getting a substance from a new provider, have had a period of abstinence, like have just maybe come out of treatment or recovery, or people who have chronic health conditions should be using an overdose prevention site every time they use. And episodic overdose prevention services are like OPS, but without a fixed address. So it's the same thing. It's witnessed consumption. It's overdose reversals in the event that somebody does overdose. And they're really good for places where substance use is not tolerated or heavily stigmatized, because it can be done a little bit more discreetly. So on a job site, it could be as much as having a buddy there who you know that you can trust, and he can just witness you use and watch you to know that, you know, if he sees signs of overdose, that he can respond. But it doesn't have to be a very formal or structured. It's really just somebody watching your back. And then the health contact centers, Starship in New West, there's various ones popping up in Newton and Langley. And they're basically like a hub for services that somebody who uses substances could access. So the wraparound supports, and then they would also include witness consumption and harm reduction supplies and all of that stuff. Now, for people who have problematic substance use, but don't have a goal of reducing that substance use, or maybe need more specialized supports, there's actually a whole host of services that are available, not all in New West, but many of them are just across the bridge in Surrey. And I'm a little embarrassed to say that up until about 8 months ago, I didn't know half of these existed in Fraser Health. So really valuable services. So the rapid access and addiction care clinics, they offer low barrier responsive care to patients with substance use concerns. And their goal is to assess, stabilize, and then transition to community-based programs. And the best thing about the RAC clinics is that they're staffed with people who understand substance use, who understand substance use disorder, who understand the shame and stigma that comes with it, that unfortunately people still experience if they go to just a community clinic or they go to the emergency room. So the RAC is a safe place for people who use substances. And many people who go to RAC would get connected or referred to an OAT clinic, so opioid agonist treatment. Most people, when the common one everybody knows is methadone or methadose, but there's other ones including Suboxone, and we're actually getting now into, I'm going to skip down the list a little bit, but injectable opioid agonist treatment and tablet injectable opioid agonist treatment. So IOT and TIOT. It's basically prescription heroin or prescription opioids that can really replicate sort of the powerful effect of the illicit drug market, and typically indicated if sort of traditional OAT therapies were not effective. We also have a managed alcohol program. So alcohol is one of the substances that doesn't get a lot of love from harm reduction, but substance use disorders with alcohol are extremely common, typically treated with detox and a treatment program. But for people who have severe and chronic alcohol substance use disorder, the managed alcohol programs can provide controlled access to alcohol coupled with wraparound services. And in these cases, we often see a great improvement in quality of life for people who simply aren't going to stop drinking, but it's a way for them to have access to regulated supply And yeah, so that's available in Surrey. Intensive case management teams. So ICM and ACT are team-based models serving individuals with severe substance use who usually have concurrent mental illness and experience homelessness. And then we're getting the fentanyl patch program provides fentanyl patch for clients diagnosed with both opioid use disorder and chronic pain. For those who have abstinence or greatly reduced substance use as part of their goal or part of their care plan, the best service is the referral coordination service. So it's a centralized team at Fraser Health that screens and matches referrals or applicants for bed-based treatment programs, ensuring that the client is going to be matched with the best programs, because even across the region, we have varying degrees of philosophies, I guess, around what treatment looks like. So some places are strict abstinence, zero tolerance, whereas others appreciate relapse as part of recovery, or that some people just want to minimize substance use. So this referral coordination service is really good at matching programs to participants. And Maple Ridge Treatment Center is sort of the Fraser Health owned and operated bed-based in Maple Ridge. And then we have a host of contracted bed-based treatment services that offer stabilization beds, transitional living, and intensive residential treatment. And that's it. That was a whole lot of information.
That's great, Tyler. Thank you so much. And yes, that was a lot of great information. A really practical question that's on my mind is, all of the services you just shared with us, where can people find out a little bit more? Where can they access, contact information? Is it, should they go to Fraser Health's website? You've got it here on the screen. Where should they start?
Yeah, so fraserhealth.ca, the website does have all of the information that I just shared, but admittedly, it's a big website, and it can be a little bit complicated to navigate, and recognizing that sometimes people have computer literacy or technology literacy or may not have access to the internet. You can always pick up the phone, or you can pop into one of our public health units. So the one in New West is up at Royal City Mall, I think it's called. And so you can pop in there, and even if they don't have the service, they can at least kind of point you in the right direction. For anybody who's watching this and wants to learn more about any of the services or be connected, please don't hesitate to send me an email directly. I'm happy to act as sort of a systems navigator for you, recognizing that sometimes that first step to accessing services can be really overwhelming. So I'm happy to get you connected.
That's a really generous offer. Thank you for that, Tyler. And one more question kind of on the services side of things, and I'm sure it's maybe a different answer for some of the different programs, but do people need referrals from like a GP or things, do you need some kind of is there a two-step to get into some of these, like, I'm thinking about the management, some of the management programs that you talked about, like opioid agonist and things like that. Do you need a referral for programs like that?
Yeah, so most do require a referral, but we've been working really hard to lessen the barriers, or at least create programs that can make that sort of referral stream a little bit smoother or quicker. So in the past, referral processes, needed GPs to fill out pages and pages of paperwork, usually at a great cost to the person who wanted the referral. Now, if you were to go to the rapid access clinic, would be sort of like ground zero for anybody who was like brand new to accessing services within Fraser Health. Those are the people that are definitely going to sort of triage where you need to go, and they're going to make sure that that referral process gets started based on what your goals are.
Awesome, thanks for that.
If someone were to call Fraser Health, like one of the public health clinics, would they be able to provide the right referrals or resources?
Absolutely, they could.
So I'll make sure in the comments of this video that some of the information I do include is the phone numbers to Fraser Health or whoever it is. Just thinking from the business perspective, they may say, okay, I'm ready to help you, and I have no idea what to do. So just to be able to give them an avenue.
Absolutely. And again, please feel free to point people in my direction. I really don't mind helping people navigate the systems. It can be a little tricky giving vague kind of go-to areas for folks without actually knowing a little bit more about the specific situation. So yeah, put in the comment section that going to calling any Fraser Health line, typically the person on the receiving end is going to be able to point you in the right direction. And if they're getting nowhere with that, then they're welcome to reach out to me directly.
That's great. That's great. I think that's all the questions that came up for me. You had a really comprehensive presentation, and I really appreciate it because I didn't know there was as many resources in our region as there are. So it's really, really great info to know.
Yeah, it's been a great perspective shift for me coming from working in community that has for most of my career been in the Fraser Health region, but been very community specific, and then coming to get that regional lens and seeing everything that's out there. It's really highlighted that we need to continue to work at making these services more well known, because even a lot of experts in community don't know the whole scope of what's available, and we really do have something for almost anybody who uses substances and at those different journeys on the spectrum of substance use.
Thanks for that. I do have one last thing to ask, and just I feel like while we have you and your expertise, Tyler, and your experience in working with people who use substances, something that stood out to me from the first part of your presentation was talking to people about substance use in a non-judgmental way and not making that assumption that, that something needs to change, and not entering the conversation from that entry point. So I wondered if you had any advice for those of us, and particularly, business owners, or if someone we know might share with us something about their substance use. What would you say, maybe like a couple of ideas of how to respond that would be a little bit more open? I'm thinking maybe ask a question, but I just would love to hear, if you have a couple of practical suggestions for how maybe to initially kind of open that conversation without it being judgmental or shutting that person down.
Yeah, I think that it's really good to acknowledge that person has trusted you with that. Substance use is still largely considered moral failing, and it is heavily shamed in our society. So when somebody is willing to open up to me about something I know they're fearful to talk about, I'm grateful for that, and I always want to make sure that I give them space. So if somebody working in a community setting, if somebody were to come to me when I was busy, I would make sure that whatever I was doing was not as important, because I want to make sure that I'm giving them all of the attention that they deserve. Sometimes that window of opportunity for people to talk about substance use or seek support in substance use, that window is very short. And I know that if I were to seek help and somebody sort of brushed me off or didn't give me the space or acknowledgement, I wouldn't be likely to talk to them again about it. And it might actually sort of reaffirm fears that talking about it isn't going to be helpful. So I think, yeah, just recognizing that you're in an incredible position of power in that person's life, and making sure that that isn't abused, forgotten, and that you really give the person the respect that they deserve.
That's great. Thank you so much. Great advice. Appreciate it.